Hi, my name is Danielle Jowers. I'm doing a med reconciliation on an 80-year-old white male. He currently lives with a 71-year-old wife. She helps keep all of his medication and doctor's appointments, lab works, doctor's appointments, anything that he's going to have to keep everything straight for his health. She keeps it in this book right here. It's actually really good. It has all of his doctors, and it's got a separate tab for each one. It lists all of the medications that he's currently on for that doctor, any changes that have been done for the medications, whether it's an increase or decrease in dosage or it's completely been discontinued. She also wrote down all the doctor's appointments in this book, so that way they know when the next doctor appointment will be. If there's any changes on the doctor's appointment, it's going to be placed as well. He is able to actively participate in his plan of care. He's able to understand any changes that are done. He's able to keep up with anything that may be significant with his care. He is diagnosed with hypertension, hypothyroidism, enlarged prostate, atrial fibrillation, and a plasma disorder that's called monoclonal gammopathy of undetermined significance. Pretty much what's happening is abnormal plasma cells are being produced. It can develop into bone cancer if it becomes malignant, but at this time his is dormant. He does have some kidney deterioration because of this disorder. He has urine that has protein in it. I will discuss this a little bit later when we get to the medications and so forth. I did not find any discrepancies in the medication list as I was going through it. The medications are as followed. He takes bisoprolol 5 milligrams by mouth daily. He takes a clonidine 0.1 milligrams by mouth daily as needed for blood pressure greater than 170. He says that he normally takes it about 4 o'clock in the evening because at this time his blood pressure starts to raise up from after he takes the blood pressure medications in the morning. He said that he normally checks his blood pressure about 3 to 4 times a day, which is a good thing. He's very on top of making sure that his blood pressure stays in a normal level. He is aware that if it does not fix with the clonidine, that he needs to contact his doctor and he needs to go to the ER to get treatment. He also takes Lasix 40 milligrams by mouth daily. He takes levothyroxine 75 micrograms by mouth daily, losartan 100 milligrams by mouth daily, potassium chloride 8 milliequivalents by mouth daily, paracalcitol for his kidneys. He takes 1 microgram of this daily. He takes Flomax 0.4 milligrams by mouth daily. He takes Coumadin 3.5 milligrams by mouth daily. He does have a 3 milligram and a 1 milligram bottle that I noticed. He stated that he takes one of the 3 milligrams and he takes the half milligram and splits it in half. He takes one pill and then places the other one back in the bottle. He does understand that he has to have his PT-INR checked regularly to make sure that his blood is not too thin. He has went to the doctor recently and he got all his blood work drawn. They said that everything was fine and they did not change the dose at this time, but he is aware that they do change it based off of what his blood work is. He's also taking simvastatin 20 milligrams by mouth daily. He's taking trazodone 50 milligrams by mouth once daily at bedtime. He understands that this is to help with rest. He does know not to take it in the mornings. He also has rheumatoid arthritis. He takes acetaminophen 1300 milligrams Q8 hours PRN for arthritis pain. He is aware that he does not need to go over 4 grams in a 24-hour period. We did sit down and we did the math. He is taking 3,900 milligrams daily if he does take it every 8 hours as prescribed. So he will not be going over the 4-gram limit for the day. He does take an Ensure every morning because of the protein loss from his kidneys to help make sure that he keeps that protein to help with tissues. He does take a complete multivitamin age 50 plus, 1 tab daily. He takes fish oil 2,400 milligrams every day, and he takes a vitamin C 500 milligrams every day. These are all the medications that he stated that he takes. He did have some recent changes. The medications, he knew that he was not supposed to take them. I stated that he needed to bring those to the pharmacy so they could be disposed of, so he would not be taking them by accident. 3 safety concerns that I did notice. He is forgetful sometimes, but he will readjust himself to it. He sometimes does take a little more time with answering than somebody that is less forgetful. He does have to walk with a cane, so I stated that he needs to kind of keep the room well lit, so he can kind of watch for anything that may trip him. I let him know that he needs to follow fall precautions because of him taking 2 blood pressure medications and 1 as needed because of the process of probably having orthostatic hypotension. I told him that he needs to sit on the side of the bed for a little bit before he tries to get up to decrease the amount of dizziness that he could possibly have. He stated that he did understand why he needed to do it. We did have a little teaching plan that we did. I went over safety precautions with him. I talked about needing to walk with a walker or a cane or some form of stability, so that way he's more stable when he's walking. He does have a cane that he uses. He also has a little motorized scooter that he can sit down on if he does become dizzy. I told him that he needs to try and use that. That way if he does become dizzy, he can sit on it to get his bearings. I also stated that he needs to keep the house well lit so he can see where he's going, make sure that he's not going to trip on anything. I stated that as well he needs to sit on the side of the bed. I did an evaluation with this information. He was able to state exactly as to why he needed to do each of these. He stated that he needed to walk with a cane because it gives him stability, especially when he's walking for long distances. If he is going to be going somewhere, he needs to bring the walker that has the chair with him so that way he can be able to sit down when he becomes tired. He stated that he needs to keep the rooms well lit because, especially with him having grandchildren, they're able to put stuff somewhere and forget it, or they just don't want to clean it up. So he would be able to see the toys and be able to not slip on them. Also, he said that he knows that he needs, when he's getting up in the mornings, he needs to sit on the side of the bed before he just gets up because of the chance of his blood pressure dropping really fast. He said that he sits on the side of the bed for about a minute or 2 and then he gets up and starts the rest of his day. I feel as though the evaluation of the teaching plan went very well. I will continue to monitor this patient to make sure that everything goes well. Thank you so much, and I hope you enjoy this.